All right, good afternoon, and thank you for being here. Today, the Houston Health Department continues to vaccinate people with the Moderna COVID-19 shot and a plan that we're striving every day to be more equitable, efficient, and making sure that we kind of get around as much as possible throughout the city of Houston. As of this morning, the Houston Health Department has received a total of 41,950 first doses and administered, as of this morning, 33,839 first doses. That's about 80% being administered of what we have received. So again, as of this morning, we received a total of 41,950 first doses, and we've administered 33,839 first doses. This past weekend, we had a very successful vaccination clinic in partnership with Hope Clinic in A-Leaf, Westwood area, and the Vietnamese Doctors Association. 500 people successfully received their first shot of the vaccine. I want to thank Director Williams and his team and doctors and nurses at Hope Clinic for making that possible. We plan to announce another community clinic this weekend. Somewhere out in the community, looking at that northeast sector in northeast Houston, and I know Director Williams will make that happen. So, and then moving forward, our strategy will focus on putting the vaccination into communities that are high risk and vulnerable. And that's the goal. Everybody needs the vaccine. We certainly want everybody in our city to get it. That's the only way we're going to achieve the herd immunity, and we want to make sure that it's equitably distributed. Also, the Houston Health Department has received a total of 18,600 second doses, and we've administered a little more than 2,300 already second doses, and the City of Houston Health Department has 11,971 second dose appointments scheduled for this week. And again, let me say to you, if you haven't gotten a call, you will be getting a call or getting notified by the City of Houston Health Department. Please answer the phone, even if it's a number that you're not recognizing. And if you haven't heard something within, let's say, 48 hours since of your scheduled sort of appointment, then notify us. But if you're outside of that window of 48 hours, if you're 3, 4, 5, 6 days away, please, we will ask you not to call. That will only slow things down. But I do want to acknowledge that 11,971 second dose appointments have already been scheduled for this coming week. In fact, I got my second dose of the Moderna vaccine this past Saturday, Mayor Pro Tem, and things went well. There he is, right there. All of them biceps. You can tell he's been lifting weights, and so. But things went well. A little soreness in the arm, but that went away in 24 hours. And then the following day, last night, I ended up taking a couple of Tylenols, and then within 15 minutes, I was good. So I want to encourage people, when you get the opportunity to get that first shot, and then we're doing everything we can to make sure you get that second shot. And then bear in mind, it doesn't have to fall exactly on that 28th day if you got the Moderna. It could be that 29th, that 30th, or 31st day as well. And it's that Dr. Plummer. Welcome, Dr. Plummer. It's good to have her. And, of course, we got Mayor Pro Tem Dave Martin with us as well. Finally, the focus on vaccine does not mean we can stop focusing on prevention and testing. So I want to remind people that the virus is still very much within our community. And let me give you a little proof of that. Today, the Houston Health Department is reporting 1,089 cases of COVID-19, bringing the total case count for the city of Houston to 158,751. So that's 1,089 that we're reporting today. Quite frankly, in the last several days, That number has been over 1,000. So there's still a lot of community spread. Sadly, the total number of deaths increased by 6. Since the start of the pandemic, 1,784 Houstonians have died of COVID-related complications. So the virus is still very much present. Until you get these vaccines, continue again to wear the mask, social distance, wash your hands, all of the things that you've heard over the last 11 months. We are encouraging you to continue to follow the healthcare protocols. The impact on our community is sobering, and families are still being devastated by the virus. I encourage everyone to continue to adhere to the protocols. In fact, starting today, a federal mask mandate requires face masks to be worn by all travelers on airplanes, ships, trains, subways, buses, taxis, and ride shares. Again, airplanes, ships, trains, subways, buses, taxis, and ride shares. You are mandated to put on your mask to cover your mouth and your nose. The mandate is being enforced by the Houston Airport System. All people in our airports over 2 years of age must wear a face covering that goes over your nose and mouth. The federal mandate is necessary to slow the spread of the COVID-19. Anyone who refuses to comply with this federal mandate may face civil penalties, including being immediately escorted out of the airport. I hope people will comply and we won't have a need to have them escorted out of the airport, and we have to all work together to end the pandemic and return to a normal way of life before the end of this year. It's my hope that by the end of this month, February, that we'll have a dramatically different landscape than the one we are walking into as of February the 1st. In order for that to take place, we're really going to need people to work closely together to do that. I'm continuing for city employees working remotely. We are continuing to be very reluctant to schedule any permitted city-produced sponsored events in the month of February, with very few exceptions. And then hopefully as of March 1, we'll take a look and see where things are. So please work with us as we move forward in this regard. Let me first call on Dr. Peirce, and then followed by Director Williams. Dr. Peirce.
Thank you, Mayor. So to give an update of our overall situation is that many of our metrics are starting to show some improvement, not all of them, but many of them are starting to show some improvement. We're seeing hospitalizations have leveled off and are slightly decreasing. We're seeing that both when we look at the TMC data as well as when we look at the CETRAC data. We're seeing that positivity rates have leveled off and may even possibly be starting to go down. And we're seeing something similar with our wastewater. May have leveled off and is possibly going down. The wastewater, which is our earliest predictor, is looking like it's possibly going down. So we may be on the beginning of the downside of the second major wave that we've had. But I want to remind folks, as the mayor just said, this is not the time to take our foot off the brake. We need to continue to have our masks on, social distance, wash your hands, and get tested frequently. A couple of things about that. I want to talk about the mask and getting tested frequently. If you've been vaccinated, you should still go ahead and get tested. The reason for that is we know that some of the studies that were done looking at the vaccine efficacy looked for people who had clinical illness, that they went to their doctors and wound up getting diagnosed with COVID because they were symptomatic and ill. The studies did not look to see if people who had been vaccinated still got the virus and were therefore able to spread it but had no symptoms. So we don't know yet. So we have to, those studies are ongoing as we speak. So for those of you who have been vaccinated and were getting tested, you should go ahead and continue to get tested periodically, even if you don't have symptoms, just as we all should, whether you're vaccinated or not. The second thing the mayor brings up, this new federal mandate on masks. I want to remind people a couple of things. One is the masks go over your nose and your mouth, not just your mouth. It goes over the nose and the mouth. That's number one. Number two is the CDC guidance on who shouldn't wear a mask really is people under the age of 2 and people who are incapacitated or unconscious or otherwise unable to remove a mask in the event of an emergency. So that would mean people who are unconscious, people who are perhaps quadriplegic, maybe people have severe muscular dystrophy or severe cerebral palsy to the point where they would be unable to remove the mask on their own. So if you have a history of asthma, that does not mean that you don't have to wear a mask. If you have a history of bronchitis, that does not mean that you don't wear a mask. Everybody should wear a mask unless you're under the age of 2, unconscious, or incapacitated to the point that you can't remove the mask on your own. The face shields, I see a lot of people wearing face shields. Those are of no value whatsoever. They will protect you from getting some splatter in your face, but they don't protect anyone around you from the virus that you may be shedding. And then the last thing I want to do is I want to remind folks that our hospitals remain very full, and all of the hospital systems are hiring nurses. Right now, our rate-limiting step on the ability to take care of more people is not the size of the buildings or the number of beds, it's the number of nurses that we have working. So any recently retired nurses or nurses who are out of the workforce for some other reason, if you're thinking about getting back into it, the community could certainly use you now.
This is on vaccine. Demand continues to far exceed supply, but things will get better because we know that more vaccine is on the way. This week, our health department is distributing over 9,000 first doses to the most vulnerable. We're prioritizing approximately 5,300 doses for our area agency on aging, 2,400 for providers in vulnerable communities, and 1,300 for previously scheduled appointments. In order to follow up on the more than 70,000 calls to our area agency on aging, additions to its wait list are not being accepted until further notice. And the reason for that is to not really frustrate people. Or people who receive their first dose from the health department will be contacted and scheduled for the second dose. And that's the current state for that. But starting later this week, and maybe even as soon as tomorrow, we plan to send out a link for people to self-schedule. And that is self-scheduling for their second dose, not their first dose. We want people to check their voicemails, text messages, and emails frequently. Scheduling information and alert the COVID-19 call center, 832-393-4220, if any contact information has been changed regarding your second dose. People do not need to call the department about a second dose unless they have not been contacted within 48 hours before the Moderna's recommended 28-day due date. Our intention is to come as close to that 28-day due date as possible, but we know that the CDC guidelines has changed in regard to that. This is a process that we're trying to perfect as time goes on. As more vaccine become available, our intent is to certainly get them into more underserved communities.
Thank you. And Chief Pinion.
Thank you, Mayor. So for the fire department, today we have 59 firefighters that are positive for coronavirus, and thankfully they're all working through their recovery at home. We continue to make the vaccines available to our first responders. We do have enough on hand to administer the second dose for those that received their vaccine at fire headquarters. And Methodist, St. Luke's, and other outlets are available also to vaccinate our firefighters. I want to also stress what the mayor and Dr. Peirce and Director Williams have said as far as continuing the proper hygiene, okay, wearing your masks, proper hygiene, and the physical distancing. We have a couple dates that are coming up that are historically prime for large family gatherings. We have Super Bowl, we have Mother's Day. Let's be cautious and practice the necessary safety guidelines so we can keep working towards this positive progress that we've been making. One more thing is, sorry, Mayor, I just want to stress that please reach out to the elderly and assist them with registering online for their vaccination. A lot of times they can't get through the phone because the phone lines are busy, and it's a lot more efficient to register online. But please reach out to those elderly or neighbors that may need assistance with that type of registration. Thank you. Yes, sir. Lo que queremos recomendar a nuestra comunidad es que procuren a las personas ya mayores para que se registren para estas vacunas del coronavirus. Muchas veces las líneas telefónicas están ocupadas y no pueden entrar las llamadas y es más eficaz si se registran por el Internet. Pero muchas personas ya mayores no pueden o no saben cómo registrarse por el Internet. Y les pedimos que si pueden ayudar a sus vecinos, ayudar a las personas ya mayores para poder registrarse para estas vacunas es muy importante. Gracias.
Thank you, Chief. And I'm glad you brought up about the Super Bowl, with Super Bowl being on Sunday. Again, let's keep our gatherings very small. The same protocols that we talked about during Thanksgiving and the Christmas holidays, same apply for Sunday as well and this weekend. So let's keep our gatherings small, and bear in mind that you bring people together, then that just adds to the community spread. Having said that, we'll stop and take any one of us can take questions.
Mayor, there's been a lot of talk from DC about, the supply ramping up for the vaccines, or at least even just the information of, who's going to get what when ramping up. Has that trickled down to you guys yet, in the sense that, have you gotten word that you're going to get increased vaccine supply starting, at XYZ date?
No, not specifically. Because I served on the vaccine panel for the state, we know that an additional maybe 50,000 doses might be coming into the state in the immediate future, but that's not a whole lot when you look at the need for the whole state.
Director Williams, maybe you can answer the second part of that as well. And just like the amount of information that you have about, when you're going to get the vaccine and how much per week, has that improved in the sense of, not just the amount of notice that you guys have before you get the vaccine?
Being a hub, we know that the 9,000 doses we're getting, actually, we have to go into the system and order the doses. Of course, we order more than we know that we're going to get. And that's been pretty consistent in the last couple of weeks.
Is 9,000 the number, I guess, that we're getting on a weekly basis now?
For the city of Houston, yes. Okay. But our need is far greater than that.
And then my other question, which might be you as well, but whoever wants to take it. I know that 70,000 people, right, on that wait list for the area agency on aging. When do you guys anticipate that opening up again? I know there was a lot of interest in that, but 70,000 is obviously a lot of people.
That's really hard to discern. My hope is that our people will move as expeditiously as possible. But even if we use 9,000 for just the 70,000, it would take several weeks in order to get through that. Now, please understand that a lot of times people actually sign up for different sites. And as we go through the list, sometimes we find out that people have already been vaccinated. So we won't know until we actually sort through the list.
And my last question was about those community clinics, Mayor. You mentioned the Hope Clinic in Alief. Is that sorry, either one? Is that like
I'm a little more optimistic on the community clinics. So I think I'm going to take this one. Yes.
Is that like anyone in Alief can show up on that Saturday and get the vaccine, or is it for the Hope Clinic client base and going forward for Saturday as well in the Northeast region?
In the city of Houston, it's kind of open to everyone. But the reason why we are going to certain areas is to do as best we can to provide opportunities for people in those communities. So, for example, like at Hope Clinic, a number of Vietnamese, for example, they were able to reach that site. It was in those communities closer to. When we're out in Sunnyside, same things for people in that area. The hope is for us to be this coming Saturday out in Northeast Houston. And so that's that Cinewood and all of that area out there. So it's just closer for people to get to it. We have to recognize that there are a lot of people who are transportation challenged. They just don't have the means to get there. And then at the same time, it makes it much easier for them to get into the system and to get their vaccine. And then it provides us with another opportunity to make sure that we're having equitable distribution and that we're servicing everybody in our city. But whatever site that we have in the city of Houston, it's not just exclusive. It's just more convenient to people in those areas.
I guess I was just wondering, what those people have to do to end up getting the vaccine there, if they have to sign up through the main, process, or if their doctors from Hope Clinic are calling them, you know what I mean?
In this case with Hope Clinic, because we partnered with the Asian Doctors Association, they were able to bring some of their clients into that site. And the reason for that is a lot of private providers are not getting vaccine. And so because they don't have access to vaccine, they really wanted to find a source for some of their patients who met that 1B classification to get vaccinated.
All right, thank you very much.
It's kind of interesting because I got a call from one doctor, and the doctor was not able to get her. She was not able to get vaccinated, and so I pretty much recommend they go through the City of Houston Health Department and get vaccinated. So, yeah, thanks to Director Williams.
I have a question here for either Dr. Person, then maybe Mayor, if you could jump in. Last week I was listening into the presentation you had for the Public Safety and Homeland Security Committee, and on there you guys were showing preliminary data about the people in the Houston area who are getting vaccinated, and it said that at about 11% were Hispanic and 13% were African American. I guess just my question is, what aside from the information you guys provide in Spanish on the website and stuff, are you guys doing to reach out to the Hispanic community?
Actually, and I'm going by memory now, the numbers that you're quoting are for county-wide vaccinations. When you look at the racial and ethnic breakdown for the vaccinations that are done by the City of Houston or one of our affiliates, those numbers are larger than what you just quoted. The Hope Clinic is actually an example of what we're doing. We're going into communities where people are. The mayor has actually given me directions when he's talking about Northeast. We really haven't settled on that, but we're going to try to make it happen. And what he's saying is that, Stephen, you need to really go into the communities where people are in order to ensure access and equity. You know, the major sites, and it's really a balancing act. The major sites are the mega sites. They're good for seeing large numbers of people. And we need to keep those sites up, because if we don't really vaccinate large numbers of people, we will lose access to vaccine. But at the same time, we need to make sure that certain communities are not locked out of that system. And that's why we have this access and equity strategy, going to where the people are, whether we partner with Hope Clinic, whether we actually partner with the pharmacy and are able to actually send clients through our area agency on aging to that pharmacy, or whether or not we in fact vaccinate people through our 4 multi-service centers. If you look at the 4 multi-service centers, they were designed to serve people in underserved communities.
And along those lines, have you had pushback, Director Williams? You know, when the folks up in Dallas tried to do it by zip code, that got pushed back by the state. Have you guys gotten pushback or anything from the state, or they're like, no, you still get all your doses?
Of course not. Actually, I sat on the panel. We're actually a model. And the reason is, Dallas model, and essentially, it was exclusive to those zip codes. We don't want to do that because of what I said earlier. We want to keep the mass vaccination sites because we want to vaccinate as many people as possible. As Dr. Person said, we really want to get to more than 70% from herd immunity. But we don't want to wait till the 3rd or 4th quarter to ensure that the communities of color have access to vaccines.
And just on the mass sites, we're doing a story today about a lady who was among some people who got, signed up, felt like she won the lottery, goes up to the north side, goes up to Del Mar. This happened last week. And after spending like 3 hours on the phone, goes up there, you got an appointment, and she gets turned away. And she's sent home crying. And some other people have happened. I don't know if this is just like one situation, or have you seen any issues communicating between UMMC and you guys? Or could some of these things, I assume when you're dealing with thousands of vaccines, it's reasonable to think some things you might have some hiccups. I just didn't know if you saw anything.
I think you're absolutely correct. Actually, I got the email you're referring to this morning, mid-morning, as a matter of fact. Sometimes people think that they are actually confirmed for appointments, and in fact they're not. And that was one of the glitches that we were working on within our system. We have communicated with UMMC to make sure that all people, everybody that has a confirmed appointment, are in fact seen.
And how can they, like, what's a confirmed appointment according to the city then, if there's,
Well, you're really talking about a situation that happened last week when we were having some issues. Actually, when people go into the system, as I understand it, they will get like a number, but then they have to go to a second step to get a confirmed date and time. And oftentimes, they'll have that number and they're presented that number, but they don't have the date and the time. But that was for last week. Right now, we're going through a system with UNMC where our people are actually going into their system and scheduling appointments. So that should be much improved.
and Dr. Purse, can you talk, and I know we talk about this a lot, or it feels like I always ask questions about this, but we always get a lot of questions about people who are just honestly, no matter how many times we talk to them about the CDC guidelines, are still freaked out about their second dose. Can you explain a little bit how, if you don't get your second dose on the 28th day, like the effects of the first dose doesn't disappear?
This is a great question. You know what? Thanks for asking it, because I think that you're exactly right. We are hearing about people who are contemplating having got the first dose and not the second dose. So what we know is that the studies that have been done, they had the 95 and 94% efficacy with the Pfizer and Moderna doses, were studies where they looked at people who got both doses. So there's no study looking at what happens with one dose. But what you could anticipate, what would make total sense, is that getting one dose would be like somebody who had a mild illness. And we know from the millions of people around the globe who got minor illness, many of them lose that immunity in just a couple of months. It is the purpose of the second dose to drive home the immunity within your system, and in fact to develop those B cells and the T memory cells that will give you long-term immunity. Now, we're still going to be finding out, is long-term, is that 1 year, is that 5 years, is that 10 years? We don't know that yet because the vaccine obviously hasn't been around that long. So we're going to have to find out what long-term means. But if you get the one dose and you don't follow up with the second one, you should fully expect that whatever immunity you got from the first dose is probably going to go away in a handful of months. So you don't need to get that second dose in order to get that long-term immunity to stimulate the memory cells of your immune system. And that's really the purpose of it, so.
Does that do it?
Yes, sir.
Okay. Well, thank you also very, very much. Appreciate it.